Okay, this is my skills videos 3, IV insertion. So I'm going to say, my name is Riley, I'm being a nurse today. I will be putting in your IV. I will wash my hands, perform hand hygiene, shut the curtain, check the patient's bracelet, make sure the names and birth dates match up, and then I will ask if they're allergic to anything. So first thing I'm going to do is look at the IV fluid bag. I'm going to make sure it matched up with the computer and what's in the document. I'm going to make sure the expiration date is good, and then I will also check I will also scan it in. So then I'm going to take a label, and I will write out a label when the IV tubing needs to be changed, the administration tubing needs to be changed, and I will write that out on here. So first I'm going to take my tubing and make sure that this rolling clamp is closed all the way, and I will shut it, and then I will remove the cap on the IV bag right here, if I can figure it out. Okay, I'm gonna remove that, and then this would be hanging, so making sure not to touch the insertion site as I am opening this up and also opening this up. I will twist this on. Alright, once it's all the way in, I will then squeeze the chamber until it's about halfway full, and it is. Then I will open my tubing to make sure that there's no air bubbles or anything. And then I'm gonna open up this. Good, making sure there's no air bubbles, and then I'm gonna set this aside. Alright. Okay. So then I will clean off my extension tubing and just set it aside. So now I will make sure that the bed is at a good height for the patient. Make sure their arm is, there's like cloth underneath their arm, and making sure that their arm is below their heart. I will palpate and assess to make sure that I can find a good vein. I will make sure to perform hand hygiene again, and then I will also put on my gloves. Alright. Oh my goodness. Alright. So next I'm going to apply the tourniquet 3 to 4 inches above the insertion site. Good, and then I'm going to palpate for this vein one more time, and making sure that we aren't losing the radial pulse while we're doing that. Then I'm going to take the tourniquet off, and then I'm going to use chlorhexidine and scrub the insertion site really hard for about 30 seconds up and down. I will then let it dry, and I will prep my tape. Okay, I wish this would get off my hand. Alright, so now I'm going to reapply the tourniquet. Good, and with my non-dominant hand, I will hold the skin below, about 1 to 2 inches below the insertion site. I should have gotten this open before. Alright. So now that I've cleaned everything, everything looks good. I'm going to hold with my non-dominant hand. I'm going to put the needle in at about a 10 to 15 degree angle, and I will wait until I see blood return. Once I see blood return, I will keep pushing, and then with my finger I will flick the catheter into the skin. Good. And then I'm going to press this button and retract the needle and put this in the sharps container. I will then grab the tape, making sure to hold this down. I will now use I forgot to talk about I don't know where it is. So I would grab extension tubing. I think we have it in here, but I grab extension tubing and attach it to the saline. And after I get the tape down and on the catheter, the IV catheter, I will flush it with saline just to make sure it's not infected or anything. All right. I will then take a non-adhesive wipe, and I'm going to wipe around here, the insertion area. All right, I will then make a label. Sorry, I lost where all my stuff. I will then grab a label and I will write down the initials, the date that it was done, the time, the gauge, and the size, and I will attach that. I'm just gonna pretend to attach because I don't want it to stick on my banana. Pretend to attach this label down here. I'm going to now take a microbacterial something and clean off my tubing and wipe it down, as well as the extension tubing, and then I'll attach it to each other and I'll put it next to the insertion site so that it doesn't pull or anything. And then I'm going to take off my gloves, wipe it down all areas with a cleanser, can't think of the word, antiseptic wipe, and then I will cap all of the tubings and all of the needles and make sure to put them in the sharps, and then I will document this entire process. And then if we are wanting to get a blood sample afterwards, oh, I forgot to take off the tourniquet too. Sorry, I forgot to take that off. So now I'm going to get a blood sample. So I'm going to make sure that the tubing matches the labels on both the patient and also in the documents. I will put the tourniquet on again. And I will take this, I'm not really sure what it's called, but I will take this and attach it to this tubing. Wrong side. And I'm just gonna twist it on here. Good. And then I will find my insertion site again. I'm honestly not sure if you take this thing out. I'm assuming that, I'm not 100% sure. I'm gonna have to look that up. But you're gonna find the site again. And then I'm going to insert it. This is going to be at 50 or 15 to 30 degrees angle in. Once I start getting blood return, I'm going to take off the tourniquet, like good flowing blood return. And then I will take this tubing and I will twist it onto there, and this tube will fill up with blood. And I will do this as many times as I need blood. So if there's like 3 containers that we need, then I'll keep continuing to do this until all of the containers are full. And then I will place a gauze under or right by the insertion site as I pull out the needle. And then I will cap this and put it in a sharps container. And then as I pull it out, I'm not going to put any pressure on it. And then as I remove the needle and it's out, I will apply pressure with the gauze for about 2 to 3 minutes and put a Band-Aid on it. And then I will clean up all my stuff, making sure to get the blood to the specimen lab, making sure everything's cleaned off. There's no sharps anywhere, making sure to put them in the right area, making sure that everything's initialed and dated. And I think that's about it.